Okay, so for this presentation, I will be talking about depression and age among older adults. Now, the relationship between age and depression among older people is very controversial. So some studies have found that the likelihood of depression increases with age. Others have found that the likelihood of depression decreases with age. And there are some studies that have pointed out to a U-shaped relationship between age and depression. This means that the risk of depression can be different across age groups, and furthermore, the factors associated with depression could also differ by age. So the research questions for this study were, first, what is the relationship between age and depression in older adults? Second, what are the demographic, health, and social factors associated with depression? And third, how does age modify these associations between these factors and depression? So in order to answer these questions, I used data from the Singapore Chinese Health Study. This is a cohort of Singaporean Chinese that was established in the 90s, where participants were followed up every 5 years. For this analysis, I will be using data from follow-up 3, which took place between 2014 and 2016 and included about 17,100 participants. The mean age at the point of the interview was 73 years, ranging from 61 to 96 years. So depression was defined as having a score of 5 or more in the geriatric depression scale, which was validated in Singapore before. And we ran multivariable logistic regressions to compute the odds ratios for the association of demographic, health, and social factors with depression. So we first started studying the relationship between depression and age. In this graph, I'm showing the results of a regression spline using age as a continuous variable in the x-axis and the odds of depression in the y-axis. What we find is that the relationship between age and depression follows an inverted U-shaped pattern. So compared to the odds ratio of those age 65, we see that the risk for depression increases significantly between age 65 and age 85, peaking at around age 75. So to identify age groups at risk of depression, we use this graph to group our participants in 3 age categories: the youngest old, those with less than 70 years, the middle old, those between 70 and 80 years, and the oldest old, those with more than 80 years. We then looked at the demographic factors associated with depression using these age categories, and what we found is that compared to the youngest old, those in the middle old group were 20% more likely to be depressed, while those in the oldest old group had no increased risk of depression. In addition, men being unemployed and having no formal education were factors associated with depression. We also included health factors in the model. In this table, I'm ranking all the significant health factors in increasing odds ratio estimates. So what we found in our study is that having major chronic diseases, functional limitations, poor physical functioning, having fair or poor cell-rated health, being cognitively impaired as measured using MMSE scores, having function limiting pain, and poor sleep quality were all independent factors associated with depression. We also included social factors in the model, and we found that living alone, having less than 1 hour per week of social participation, and particularly having low social support were factors associated with depression. Finally, we ran a stratified analysis by age groups to compare the odds ratio estimates for all these factors between different age groups. So in this table, I'm compiling all the factors whose association with depression was modified by age. So for example, we found that compared to women, the risk of depression among men increased with age groups, with those in the oldest old category having the highest risk of depression. Conversely, when it comes to functional limitations and cognitive impairment, we find that the association with depression is attenuated with age. That is, the odds ratios for depression for those with functional limitations or cognitive impairment decrease with age groups, with those in the oldest old group having the least risk for depression. So in conclusion, we found that the likelihood of depression was highest in the middle group, those that had between 70 and 80 years. And well, this is a vulnerable group that is in the midst of many transitions from employment to retirement, with increasing health deterioration, onset of diseases, and so on. So they constitute a vulnerable group that could be targeted in community interventions that address depression. Similarly, the highest risk of depression in men, especially among the oldest old, has also implications for early screening and intervention in the community. And also the fact that the odds ratio of depression, the odds ratio for the association between functional limitations and cognitive impairment was decreasing by age group, suggests a coping mechanism among the oldest old survivors. And this could be due to the on time of time hypothesis, which says that we show better adaptation to stressors when they are most likely to occur. So with that, I would like to end my presentation. I will welcome any questions now or later. Handing over to you, Luis.
Yes, thank you. Thank you, Jon. Depression and cognition in older adults and challenges of finding which direction these associations go has been is a very important question. I didn't have any question, and we're a bit short of time, but if I can just ask a quick question, and if you could use the chat maybe to answer, to maybe think about what might the survival bias impact be, and your findings as the older adults who stay in these cohorts tend to be the better fit as well. So if you could just comment on how you might consider this in your future research as additional discussion points, that would be lovely.